Welcome back to Voices of Victory. Joining me now in our medical segment is Dr. Frederick D. Harris of the Cleveland Clinic. Thank you for joining us today.
Thank you. Thank you for having me.
First, let's hear a little bit about you. Tell us a little bit about your medical background.
Well, I'm a native Clevelander. I've been practicing for 33 years. I started out my first 16 years in private practice. I was on staff at 10 different hospitals in Cleveland, and at the 16th year, I transitioned and became a Cleveland Clinic employee, where I've been at the same spot in my office at Cleveland Heights. I'm a board-certified internal medicine specialist, and we practice preventive care as well as I do hospital rounds and see patients everywhere.
Wow. Let's just talk a little bit about COVID and the vaccinations. You know, over the months and where we are today, let's look at the importance, first off, for being vaccinated now. Doctor, how serious is it?
Oh, it could never be more serious. Everyone needs to be vaccinated. It's cheap, it's free, it's effective, and there's no safety issues. For example, I was looking at my statistics in June with this most recent surge. They were saying that 97% of the people that were hospitalized were unvaccinated, 97%. 99% of the deaths were people that were unvaccinated. So if that doesn't show you that everybody needs to be vaccinated, I don't know what will.
And then there's the issue of people of color in particular. Let's talk about our people and the fact that there is still a large number of people in the Cleveland area, Cuyahoga County, and the region still not vaccinated.
We have underlying conditions, black people. We suffer from diabetes, hypertension, high cholesterol, obesity, as well as have a disproportionate cancer risk when we have lupus, sickle cell, kidney disease, lung disease, etc. People with these underlying conditions, they don't do well. They hit the hospital. In fact, I think the statistic says it's 12 times more likely to die with these underlying disease. So our people come in the equation with underlying disease to begin with that need to be treated. And we disproportionately are dying at up to almost 2 times to 1. We're disproportionately getting affected almost 5 times to 1. And we get hospitalized 4 to 5 times to 1. Now with this Delta virus, it's ultra contagious. So it's not leaving anybody behind. If you're not immunized, it will find you. Another concept that we need to get over to our people is that vaccines prevent disease. Vaccines does not prevent infections. So if a lot of people get bent out of shape when they see somebody getting infected. They say, oh, he had a shot and they got infected. Well, what does the vaccine do? The vaccine declaws, in other words, it takes the sting out of the disease, but it doesn't stop the infection. So we're going to get breakthrough infections. In fact, the breakthrough infection rate is very low. It's 1 in 5,000. So I basically tell people we basically had 2 lines. It's 2 lines. We got one line, 656,000 people that have died to date. 656,000, you get in that line, or you get in line, get your vaccination, and you might get a sore arm, some fever, malaise, whatever you get, nothing lasts over a day or 2.
What are we up against now as we're going into flu season and everything else that might be coming our way?
Well, even before that, I mean, just yesterday we had 7,800 cases in Ohio alone. The day before that, we had 6,800 cases in Ohio alone. Ohio is the 4th increase in cases in the country right now. Akron General, the hospital and the ICU is filling up with kids with COVID and so forth and so on. So it's, people are to understand we are ticking away right now. We only have to wait till winter. It's 150,000 cases a day in the United States, 150,000 cases every day, 1,100 the week before that. People are dying. So, and mostly, guess who it is? The people that are unvaccinated. The people are unvaccinated are the people who are, that's what we call avoidable deaths, avoidable deaths. So take heed, follow the science, get your shot, protect yourself and protect your family. It's safe, effective, and it's free.
Thank you for joining us today.
Thank you. Thank you for having me.